Okay, so your experience is largely falls on the management sector,
Yes, ma'am.
not necessarily public health.
I have no experience in public health, ma'am.
Okay, now for the GCG, normally the appointees will only have a duration of 1 year, after which there should be an evaluation of their performance if they are actually qualified to continue. They should have a rating of above average or average. Am I correct, Mr. Kim? Sir, nakamute po kayo.
But in the case of General Morales, he's now a direct appointee of the president. I think when the UHC law was passed, somehow there is implied amendment to the GCD law, which is a 1-year requirement. So this thing has to be stressed out. But be that as it may, our performance evaluation for director is also included.
Okay, so have you deliberated on his performance evaluation? Because it's been 1 year. Kung July 2019 po siya in-appoint, August na po ngayon, so dapat meron na kayong evaluation. Ano pong grade ang binigay niyo sa kanya?
Yes, it is now the record of GCG. We will submit that thereafter. I'll ask my staff to submit the direct performance evaluation sheet for General Morales.
So wala pa hanggang ngayon?
Presumably, meron na siguro, ma'am.
Anong meron na siguro? Kayo yung namumulat
Kasi
naman kung alam niyo.
I'm not sure kung what 28, kasi he was there 2018, later part, and it's for 2019. He will be graded for 2019, and for grading for 2019, just like a performance evaluation, there is a need to submit documents, and by reason of the pandemic, somehow documentation has to be submitted by the PhilHealth, because this is also peer grading with the peer of the PhilHealth board for President Morales.
So let me ask you, sir, have you actually convened with the members or the board of whoever in the GCG that is responsible for evaluating the current PhilHealth chief? Have you met with them and have they submitted an evaluation?
It is only a documentation. We have a circular for performance evaluation for directors, and I suppose there already a submission. I'll try to find out if these documents for 2019 already been submitted to my office.
Kasi Mr. Dagpin, napaka-mainit po na usapin ngayon. Siguro nung pumutok na itong issue ng PhilHealth, dapat meron na kayo kaagad na ginawang hakbang ukol dito. Kasi that in itself, if he didn't perform satisfactorily, that could have been the basis to remove him immediately, or at least not to have his term extended. Kayo, what was your personal assessment of him? You can tell us.
Based on the totality of the PhilHealth, for 2017 and 18, which is under my tenure, the PhilHealth did not pass the performance scorecard. For 2019, I have yet to validate because they submitted all the documents August 4 this month. So we need to validate these documents submitted per the performance scorecard so that I could assess also, being he is the president of PhilHealth, how PhilHealth is being managed.
Teka muna, so ang sinasabi nyo, sa 2017 and 2018, you already assessed that. You submitted it.
Yes.
Who was heading the PhilHealth at that time?
For 2017, it's De La Serna.
And what grade did you give him, or what rating?
I have no record right now, but the one attending now is not part of the one of the division, the corporate standard division. The other one there is the OGC. So
So hindi
I'm
mo
sorry,
matandaan.
that give you
That
the
was just
record right now.
that was just barely more than a year ago. I mean, 2017, 20, di ba, less than 2 years, iisa lang tao yan, di mo matandaan yung evaluation. So you're telling me that from the time that General Morales joined PhilHealth, you have no evaluation of him yet.
Yes, because it's a later part of 2018.
But
So I can
I'm sure
validate him for 2019.
I'm sure you've, if it was submitted to you August 4, I mean, I would hope that you've browsed through some documents already regarding his case. What would you recommend to the body?
I that is based on the data. I could not speculate right now, ma'am. So it would be unfair to judge him based on uh, a conjecture.
Conjecture,
So,
really, yeah?
yeah,
Okay, with
yeah.
all of the data that we have, I guess you haven't really done your responsibility of reviewing, and especially it's already past the 1 year mark. Not only should you start the review when the 1 year mark has ended, but prior to that, you've already should have done your due diligence. Late na po
But
kayo dito, di ba?
I not necessarily agree with that, ma'am, because if I could browse my document management system right now, I could see that record. I could not remember all the records because there are a lot of officers under the GOCC. I'm
But
not
surely
superhuman.
that you know what, even prior to coming to our hearing, and you know that this is what was going to be discussed, it didn't even pique your interest to take a look at his records. I mean, you cannot use as an excuse, even if this is an appointment by whoever in government. It is your responsibility in the GCG to be able to find out how the ones that you recommended is actually performing. Section 13 of the UHC law requires all appointed members of the board shall be required to undergo training in healthcare, financing, health system, costing health services, and HTA prior to the start of their term. Non-compliance shall be a ground for dismissal. I would like to ask General Morales, did you actually have any of these training, and do you have proof that you participated in these?
I took the Institute for Corporate Directors course, ma'am, and I have proof of this.
Okay, how long was the training and who conducted that training?
It was conducted by the Institute for Corporate Directors. I think it was headed by Dr. Jesus Stanislao. And it ran for several weeks. It was an after office course. I'm not sure exactly how long it ran. I think I took it in the around 2012 before I got into the uh, Mutual Benefit Association.
Okay, so can you tell me again the name of can you tell me again the name of this course?
Institute, well, I'll have to check, ma'am. I have to check the exact name, but it was conducted by the Institute of Corporate Directors and headed by Dr. Jesus Stanislao.
Okay, so what is it mainly? Is it a study in management? Um, what was the course about?
Mostly board activities, ma'am. How the board decides, how policy is made, the dynamics in the board, and then we have lectures from actual board members from the corporate world. That was the
reimbursed properly. In fact, even your policies towards OFWs are being questioned. You're giving funding to hospitals that have less bed capacities than PGH, but who have received more from the government in terms of support. So these things makes us doubt that you're actually in tune with the public health sector. What can you say to that, General Morales?
These are not new issues, ma'am. They have already been in existence even before I was here. And I think they have been exacerbated by the COVID pandemic. So,
So
yes.
meaning to say, these anomalies have been present since the past. So it is actually quite uh, okay for you just uh, to be leading such an organization with that type of track record.
No, ma'am.
So
I,
that's why I go back to my previous question during the last hearing. What steps have you taken to curb corruption in the PhilHealth? Ano pong ginawa ninyo para mabawasan man lang ang korupsyon sa PhilHealth?
well, with the extent of corruption in PhilHealth, I appreciated that we needed to put in an information system. But I miscalculated the amount of time that it would take to put this up. I thought 1 year would be enough. And as we can see, it is not yet being implemented. And
Alam niyo,
secondly,
sir, yes, yes. Okay, go ahead, please.
uh, PhilHealth needs a large-scale revamp. I was exploring, me and my executive vice president, we were looking for a global consulting firm that we could take on to help us in the transformation because the skills necessary, the experience necessary to transform PhilHealth cannot be found inside PhilHealth. It has to be sourced outside. We have not found this external partner, although we are still hopeful that we can. I think the main issue here is the funding for this kind of engagement. So those are the two main things that we tried to do. Opo.
Mr. General Morales, number one, kahit na gaano kagaling person natin, I think chief of staff ba ninyo or one of the ones assisting you who quit. His name actually, I don't quite remember his name now.
Laborte po, Laborte.
Yes, he mentioned that there are so many actually volunteering at a lower cost to provide you with IT support and other consultancy services, of which it was never really encouraged. In fact, yung walang mga lowest bidder kasi only one would bid in a particular project. So matanong ko sa inyo, can you give me a list of those that won the projects within the past year or the ones that you considered to have been qualified? I would respectfully, I would ask the Secretariat to please ask for a copy of the companies that usually win bids with the PhilHealth.
Yes, ma'am. We have a list of companies, but these are providers. In my the way I look at them, they would not be capable of providing what PhilHealth needs. They can provide hardware, they can provide software, but the information system development of the scale needed by PhilHealth would need a major player.
Oh, so what's the name of the company that you chose that's a major player?
Wala pa ho kaming napipili. Wala pa. What we were looking at, we were imagining we could get something like Google or Microsoft.
Yes. Well, that would be ideal if they meet the requirements. But you know, our country, I think we can boast of a lot of IT professionals here are very qualified. So it's very, well, almost unbelievable to say that a system like PhilHealth cannot find qualified individuals uh, to be able to help you with your setup. Now, This is my last question, Mr. President. With regards to your qualification as an indirect contributor, it should be either you're um, identified with the DSWD, indigents, Pantawid Pampamilyang Pilipino, uh, persons with disabilities, senior citizens. Um, how can you identify with any of them?
Well, I'm a senior citizen, ma'am, so I guess I would qualify in that sector.
Yeah, but you know what? Being one of them does not mean that you qualify. What contributions have you done for the sector you identify with?
I, um, I, I cannot, uh, in that case, just being a senior citizen, that's the only contribution I can show.
Well, okay. I guess that raises also that these qualifications need to be clarified if we are to have an effective board. Di naman pwede, porket na kabataan official ka, pero you didn't really contribute for the betterment of that sector, that you will be considered as qualified for this. Now, let me ask Mr. Dagpin, and this is again the last one. In your scorecard of the performance of your recommended appointees, what would you consider as a category that will guide you in your evaluation? What categories would you have? Or what criteria? Dapat ba on time siya palagi sa trabaho? Kailangan ba yung balance sheet nila maayos? Tell me, how do you evaluate them?
Based on our 2014 circular, uh, 60% is based on performance evaluation scorecard, your attendance, and the director performance rating, which is there is a self-assessment, there is peer grading with your colleagues. The one that's standing really is a 60% best.
Okay, kasi kung self-assessment at saka assessed by colleagues, baka mahirapan tayo dyan. Baka bigyan nila yung sarili nila ng perfect score. So where do you come in now when it comes to
the 60% performance evaluation system that's connected with the scorecard? So that is the overall performance of the GOCC. So we have the balanced scorecard, the strategic perspective, how GOCs are being run. We have there that GOCC contributed social impact, the stakeholders satisfaction.
also?
We have, yes, the finance.
Okay.
They provided the needed finance support with respect to PhilHealth. It's not really based on the dividends. That is their delivery of how they properly allocate their finance. Internal processes. That is how, just like the fraud investigation, how they will address this one. Our turnaround time of paying the claimants.
So Mr. Dakpin, with those criteria, mukhang babagsak ang head ng PhilHealth niyan.
Yes.
Kasi complaints, yes?
Yes, the last two has below average grade.
Okay, well, I thank you for your candidness at this point. That's what we wanted to drive at, that you are actually in touch with the situation, Mr. Dagpin. What we're trying to do here is this. It's unfortunate that General Morales is being advised by his doctor to take a medical. We certainly sympathize with him if he is ill. But on the other hand, maybe now that he is, he will realize also the processes that he has to go through to get a reimbursement with PhilHealth if he has to actually go through the same. And another thing is that if you leave for medical reasons, that does not necessarily put closure on your accountability and also your performance. So if somebody is just allowed to take a medical leave and not answer to the allegations, then that will not put at rest the issue that we are having right now. So that's all, Mr. President, and thank you for your time, colleagues, and to our resource persons for attending today.
Yes, thank you, Senator Ko. Your questions made me recall something that wasn't clear to me earlier. So before I recognize Senator Hontiveros, just on the issue of assessment of performance, is General De Villa still online? Yes, I can see you here, General De Villa.
Yes po, sir. Mr. President, magandang hapon po. Andito po.
Yes, so earlier you mentioned the 3 reasons why you resigned. Hindi ako ginawan doon sa third reason. Parang, can you please elaborate?
Yes, yes, sir.
Resign ka ba o pinag-resign ka?
Nag-resign po ako ng kusa. Nagkataon lang, sir, nagkaroon ng mga ibang instance. Kasi, sir, actually, sir, nung March pa lang, nung nagka-pandemic na talagang nangangamatay po talaga yung mga tao, nagkakasakit. Di natin alam, we are in a panic and pandemic, global. Naisip ko na rin po sa huwag lumabas. At wag dahil nga po, senior citizen na rin ako. Pero may trabaho po akong dapat gampanan eh. So, hindi muna po ako nag-resign talaga nung March pa. Tapos March 19 something, nag-lockdown na. And then, ito nga pong tuloy-tuloy lang po ang trabaho ko, sir. Yung ikatlo po yung sabi ko nga, the institution of PhilHealth is being attacked by so many allegations of corruption at katiwalian. So, might as well, it's an honorable thing for me, sir, to sideline muna para kasi ino-question nga po eh. So, yun po yung delikadesa.
Kasama ka ba sa mga kini-question, Brad?
Sir?
Kasama ka ba sa mga kini-question? O ikasa ka sa mga nagque-question?
Sir, actually, sir, dun sa EXECOM meeting namin, sir. Actually, sir, going back to the morning of August 6, I had a talk through cell phone kay Sir Morales. Yung nga po, he talk about on the things that some of the members of the EXECOM, ibang SBP, don't trust me. Musta ko rin siya. Nasa office na po ako noon. That was around before 8, 7:30. Yata or a little past 8. Hindi ko po alam hindi ko na matandaan, sir, yung totoong oras So nung sinabi niya, sir, sa akin, some of the SBPs do not trust me. Ang sa akin po, talagang nalungkot din ako ron. Sabi ko I'm doing I think I'm doing a very good job here in the operation. And hinaharap po nga yung pandemic, sir, every day. I don't have any driver since nag-lockdown po. Nagta-travel po ako mula Alabang hanggang sa Pasig office namin. Araw-araw, Monday to Friday, ako po talaga yung nag-work from home ako isang araw lang yata, 2 araw. Anyway, ito pong nangyari po, maybe, yung mga kasama ko sa EXECOM, syempre po, right naman nila yun na pagdudahan po ako. So, isa pang tanong doon
General?
Sir, opo. Mr. President.
Ano pinagdududa sa'yo at bakit nawala na tiwala?
Hindi ko rin po alam, sir pero I have some theories po, Mr. President. Yung pong isa doon, hindi po kasi ako masyado nagpa-participate doon sa EXECOM chatroom namin sa Messenger na doon po nagdi-discuss even at night, discuss kami ng mga yung mga trabaho po sa PhilHealth. Nakaugalian ko pong magbasa lang at kung meron po kasi akong for security reasons, hindi ko na po pinopost sa chatroom. Kunwari po, may tanong po ako sa isang SBP, nagme-message na lang po ako ng personal sa kanya, private message. Kaya hindi po nakikita talaga doon na nagpa-participate ako sa PHIC Execom. Yung po ang isa sa mga yung parang nabanggit po ni Sir Morales. And I appreciate po, I'm very grateful to Sir Morales na sinabihan ako na gano'n na yung ibang SBPs doesn't trust me. Nung August 4, halos in 10 hours na hearing po sa Senate, ang natanong pa po talaga doon ay yung sa opening statement po ni Attorney Torson Kit yun sa pagpunit ng isang parte ng kontrata, which is talaga namang hindi na po ako ang signatory doon, at saka nagsumbong nga po si Colonel Laborte sa akin na sobrang overpriced, and sabi ko hindi ako makapayag niya kasi when I was still in the military, napakaingat ko sa procurement, at wala namang problema kahit na award na yon, I can return it, the papers can be returned and re-evaluate and reviewed. So yun po. Tapos po, ang isa pang theory ko, yung paminsan-minsan during Execom, which is almost always present naman po ako. May mga instances, sir, na siyempre po ako po baguhan lang, buwan pa lang ako sa PhilHealth. Nagtatanong po ako, no? Yung mga instances, sir, gusto ko po, ang natutunan ko po sa AFP, nililimit namin yung agenda for discussion, yung mga Monday conference po. Kasi Mr. President, kumpleto na po. Kasi pag pinag-usapan po dapat ang isang agenda sa Monday conference meeting or Execom meeting namin, meron ng complete staff work. No? Meaning, marami na pong mga division or departments na nag-uusap dyan bago i-present sa Execom meeting. Execom meeting for me is very, very important. One step to board presentation na po kasi ito So, yun po, maingat. So, minsan, I saw that other agendas are, medyo hilaw pa for presentation sa Execom. That's one. And then, I think there should be some more discussions in IRM.
At pinupuna mo yun.
And,
Pinupuna mo yun, General.
Mr. President.
Pinupuna mo.
Opo. Mr. President, isa pong napupuna ko doon pag nasa Execom meeting kami. I think there should be some more discussion in the collection of premium ng OFW po, kung maalala ko. Other
Villa,
Opo.
excuse me.
Go ahead, sir.
Mr. Vice Chairman, sir.
Sige.
Opo.
Medyo mahaba yung explanation. Ang siguro, the long and short of it, ang gusto mong sabihin, bago pa man magkaroon ng formal discussion sa Execom, tapos na yung decision. Is that what you're trying to say?
Ano po
Sa mga informal discussions,
may mga ganun, sir. May mga ganun, sir. Pero ang iniisip ko, sir, parang hindi pa kumpleto po yung staff work.
Yeah, right.
Opo.
But ang point mo nga is, no, I'm not trying to make a conclusion.
Tamang paraan ng pag-ubo. Ang pagtakip sa ilong at bibig ay hindi lamang mabuting asal. Nakatutulong ito na mabawasan ng pagkalat ng mga mikrobyo o ng mga nakahahawang virus na kumakalat dahil sa talsik ng laway sa pag-ubo o pagbahing. Takpan ng ilong at bibig gamit ang braso o tissue. Itapon ang ginamit na tubig at sabon o alcohol-based hand sanitizer pagkatapos umubo o bumahing. Todo laban Todo laban kontra coronavirus disease 2019. Tamang paraan ng paghuhugas ng kamay. Ang wasto at regular na paghuhugas ng kamay ay mabisang paraan upang makaiwas sa sakit. Ito ay makatutulong sa pagpigil ng pagkalat ng virus na nagdudulot ng sakit. Una, basain ng tubig ang mga kamay at sabunin. Ikalawa, sabunin ang mga palad. Ikatlo, sabunin ang likod ng mga kamay. Sumunod, kuskusin ang mga pagitan ng daliri. Ikalima, kuskusin ang mga kuko. Ika-anim, kuskusin ang pagitan ng mga hinlalaki. Pagkatapos, kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad. At panghuli, banlawang mabuti sa malinis na tubig at patuyuin ang mga kamay gamit ang single-use towel o air dryer. Todo laban kontra corona.
sa Pilipinas ng bakuna laban sa COVID-19. Dahil dito, nagpasalamat ang ating presidente kay Russian President Vladimir Putin. Dagdag niya presidente, willing siya na maging kauna-unahang Pilipino na tatanggap ng anti-COVID-19 shots mula po sa Russia. The Philippines appreciates Russia's offer of cooperation to jointly combat the COVID-19 pandemic. The Philippines stands ready to work with Russia on clinical trials, vaccine supply and production, and other areas deemed practicable by relevant Philippine and Russian agencies to address this global health emergency. Like similar bilateral and multilateral agreements, all cooperation initiatives will be consistent with protocols for testing and health standards. International cooperation is key to effectively combat this global pandemic. Consistent with the President's independent foreign policy, we continue to work with partners across the world to ensure access to safe vaccine. Tukol naman po sa telco permits, nauna nang pinag-utos ni Presidente na pabilisin ang mga prosesong telco application. In-report ni Secretary Anyo kagabi na mayroong 1,930 applications ng na-file, 1,502 ang approved at 428 na still pending. Yan po ang tututukan ng DILG. Inuulat din ng kalihim na papatawad ng preventive suspension ang 50 barangay captains habang iniimbestigahan ng ombudsman. Ito po ay tungkol dun sa mga korupsyon na sa ating SAP. At panghuli, ipinakita ni Presidente na seryoso siya sa issue ng korupsyon sa PhilHealth. Sa bibig mismo ng Pangulo nang galing, and I quote, "Nakalusot kayo sa ibang presidente, pero dito sa akin, sad-sad talaga kayo." Dito natin makikita na walang sacred cow sa Administrasyong Duterte, lalong-lalo na dyan po sa PhilHealth. Pumunta naman tayo sa health protocol in the workplace sa applicable sa MECQ na i-report kahapon ni Secretary Lopez sa harapan po ni Presidente. Una po, kinakailangan ang pagbibigay ng shuttle service ng mga malalaking kumpanya. At habang nasa loob ng shuttle, walang tanggalan ng face mask or face shield. Walang dine-in sa mga kantin, pack food at delivery lamang po. Bawal ang common smoking areas. Pinapayagan lang po ang individual smoking areas or booths in open spaces. Kailangan may physical distancing, kailangan may face mask, face shield kung nasa loob ng isang kwarto na may higit isang tao o tuwing may meeting o nasa loob ng shuttle. Madalas na paghuhugas ng kamay at disinfection ng mga lugar. Pagkuha ng temperature ng mga empleyado at mga panauhin. Ang pagkakaroon ng Health Protocol Officer at pagbuo ng Occupational Safety and Health Protocol Committee para istriktong maipatupad ang protocols ng kumpanya. Ang pagtitrain sa mga empleyado ng bagong health protocol standard. Company visits and audits ng DOLE, DTI at LGU. Ito naman po ang August 3 to 9 monitoring report ng ating mga kasamahan sa akademya ng University of the Philippines. Ito po ang average number of new cases per day sa buong bansa. Makikita na bumababa ang mga bagong kaso mula 3,698 last July 25 to August 2 to 3,194 new cases last August 3 to 9. Makikita naman natin sa susunod na slide na bagaman marami po ang mga bagong kaso, ang reproduction number or R0 na tinatawag ay patuloy na bumababa. Magandang balita po ito. Ano po ba yung R0 na tinatawag? Ito po yung mga numero na nahahawa ng mga COVID positive. Kung noong unang linggo ng Hulyo, ang R0 ay 1.65 o more or less dalawang nahahawa ng isang COVID positive patient, bumaba na po ito ng 1.12. Kung i-round off, isa na lang po ang nahahawa. Ang target po natin, syempre, ay dapat less than 1. Ito naman po ang R0 sa NCR mula sa peak na 1.81 noong July 4 to 10 ay naging 1.18 ang R0 noong August 3 to 9. Ito naman po ang ating NCR hospital utilization. 77% ang occupied ng ating mga ICU, 79% ang hospital beds at 47% naman po ang mga ventilators. Bagamat critical level pa rin po ang ICU beds dahil greater than 70% ang occupancy, meron naman po tayong mga kinukumpleto na mga additional ICU beds. No? For instance, sa Quirino Medical Center po, magkakaroon ng 50-bed integrated emergency room, 50-bed intensive care units, at 30 beds for moderate cases. Atin na rin kino-convert po ang mga isolation room sa lung center para maging 20-bed intensive care unit. Kinukumpleto na rin ang East Avenue Medical Center bilang identified 250-bed integrated health facility for COVID. Magkakaroon naman tayo ng modular health facility for moderate cases with dormitory complex strategy dyan po sa Quezon Institute. Kasama rito ang 120-bed single dorm for moderate cases and 80 beds for health workers dormitory. Patuloy naman po ang pagtaas ng testing capacity per day dito po sa NCR. From 11,067 tests last June 27 to 3 to 14,705 per day last August 3 to 9. Sa NCR lang po yan. Tingnan naman po natin ang sitwasyon sa Cebu. No? Makikita na patuloy ang pagbaba ng mga bagong kaso sa Cebu pagkatapos ma-impose ang ECQ at MECQ. From a peak of 307 new cases last June 27 to July 3, ay naging 92 new cases na lamang po last August 3 to 9. Naabot na rin ng Cebu ang less than 1 R0 target. 0.54 na po ang Cebu last August 3 to 9 kumpara sa 1.54 R0 last June 27 to July 3. At yung target na less than 5% positivity rate, malapit na rin maabot ng Cebu. Nag 7% po ang Cebu noong unang linggo ng Agosto. Ayon sa UP, MECQ is working pero kinakailangan gawin mas epektibo ang implementasyon nito. Ito po ang gagawin ng ating gobyerno para makabit ito. Una, nagkakaroon po tayo ngayon ng agresibong pagtetest, especially dun sa mga lockdown ng mga barangays. Sa ngayon, ang Pilipinas po ang pinakamataas mag-test sa ASEAN at mas mataas pa nga po tayo sa Korea at Japan. Pangalawa, agresibong contact tracing gamit ang magalong formula. Isang tracer, maghahanap po ng 37 close contact na isang positive. Pangatlo, agresibong isolation through Oplan Kalinga at pagtatayo ng mas marami pang pasilidad, kasama na po yung pagkuha ng mga hotel rooms para maging isolation centers. Panglima, build up po ng ICU beds at pag-secure ng effective treatment interventions. Okay, nasabi ko na po kanina na medyo critical po tayo ng mga bagong ICU and bed capacity at kumukuha ng mas maraming doktor, nurse at medical personnel. Panghuli, makikita sa UP study na ang karanasan ng Cebu ay maaaring maging template natin para ma-reverse po ang surge ng Metro Manila at ng karating lugar. mayroon na po tayong 68,159 na na-report na mga gumagaling. Samantala, malungkot kong balita na 24 po ang na-report na binawian ng buhay kahapon. Sumatotal, ang ating total deaths po ay 2,294. Meron naman po tayong mahigit pa sa 1.5 million. Papunta na po sa 2 million total individuals tested sa mahigit 100 or 101 laboratories. On other matters, may lumabas pong fake news tungkol sa akin sa isang pahayagan. Well, sinabi naman po ng pahayagan na fake news talaga yon. Ang sinabi ko daw, COVID lang yan, kaunti lang na mamamatay kahit umabot pa ng 10 milyon. Hindi ko po sinabi at lahat daw po LSI ay dumating sa Bacolod. Wala pong ganyang pangyayari. Wala pong libu-libog mga positibo ang dumating sa Bacolod. Hindi po nangyari yan. Okay? Mamaya po siguro bibigyan dinaw yan ni NTF Chief Implementer Secretary Galvez para mas lalong bigyang dinaw itong bagay na ito. Ay, nandito na po pala si Secretary Villar. Welcome, Secretary Villar, ang ating isolation SAR. Tamang-tama po na dumating si Secretary Villar. Sir, Secretary, kanina po binasa ko yung ilang mga bagong mga ICU beds na ginagawa natin sa East Avenue, sa Quirino, at iba pang mga lugar. Ano pa po yung mga bagong mga isolation facilities at additional bed capacity na tinatayo po ng DPWH bilang kayo po ang isolation SAR?
Salamat po, Sec. Harry. Tama po, dahil gusto natin na improve ang bed capacity natin, pati yung ICU capacity. On August 17, magkakaroon po tayo ng additional 210 additional ICU capacity. Ito po yung ginagawa sa East Avenue. It's the DOH. Kami po, tumutulong kami sa project implementation. So we can expect within by next week, malaki po ang maging improvement sa ICU capacity. At meron din kaming additional na gagawin sa Quirino Hospital, pati sa Quezon Institute. Gagawa kami ng pop-up hospital. Ito po ay para madagdagan ang ICU capacity natin by 110 beds. So marami po tayong plano para ma-improve po ang critical care utilization. At sa ating mga quarantine facilities, we will expect that by the end of this month, magkakaroon po tayo ng, we'll be completing about 300 facilities with a total of 12,200 bed capacity. For this month, meron po tayong ongoing na 95 facilities. It's almost 3,000 additional bed capacity. Kaya marami po tayong projects at kami po nagpapasalamat din kami sa private sector na tumutulong. Meron po tayong tent na tinatayo ngayon sa Nayong Pilipino with the help of the Rason Group at madadagdagan po tayo ng 500 bed capacity. So tuloy-tuloy po ang pagtatayo ng quarantine facilities at isolation facilities.
Nagpapasalamat po tayo sa Rason Group at nabalitaan ko rin po na nag-offer po na mag-equip ng bagong 250 bed capacity sa East Avenue Medical Center ang MVP Group. Maraming salamat po sa inyong mga tulong sa Razon at sa MVP Group. Now, habang inaantay po natin si Chief Implementer Secretary Galvez at saka si Chief Testing SAR Vince Dizon, siguro simulan po natin ang ating open forum, no? Yusek Rocky, titigil na lang po natin ang open forum pag nakapasok na sa linya either si Chief Implementer o si Testing SAR Vince Dizon or si Chief Implementer Secretary Galvez. Yes, Rocky, yung unang question natin. And please,
Opo,
if you have questions to Secretary
Secretary,
Villar, please ask them as well.
Good afternoon, Secretary Roque. First question, galing po kay Ms. Ruth Palo of the Manila Times. For Secretary Roque, NDFP Chief Political Consultant Jose Maria Sison has blamed the Duterte administration for the killing of Anak Pawi's Chairman Randy Echanis yesterday in Quezon City. Any reaction to this?
Well, antayin po natin ang investigasyon ng pulisya dyan. No? Ito naman po ay kaso ng murder o homicide at inimbestigahan po yan ng ating kapulisan. No? Huwag sana pong mabilis magbintang sa gobyerno dahil ang CPP-NPA nagkaroon din naman po sila na karanasan na sila nagpatayan. Tracing, no? At sinusunod po natin yung formula ni Mayor Magalong, no? Sa Baguio po kasi, kada isang kaso, tinitrace nila yung close contact na up to 37, lahat po yan binibigyan ng swab test. Now, ang alam ko po, dahil sa Manila maraming kaso, baka hindi naman po up to 37, pero minimum 10 po ang kanilang ititrace. At karamihan po doon ay mabibigyan na rin ng PCR test dahil napakataas na nga ng ating actual testing na ginagawa sa Metro Manila. Pagkatapos po niyan, yung One Hospital Command nga po, no? Siya po ngayon ang nagko-coordinate kung saan pupunta ang mga pasyente nang sa ganun po, hindi mangyayari yung pasyente na kinakailangan ng ICU bed ay hindi makakakuha ng ICU bed. Napakaganda po ng programa ni Yusek Vega at gumagana po siya. No? At nagkaroon na po ng inauguration yung One Hospital Command Center dyan po sa opisina ng MMDA. At siyempre po, alam na po natin yung mga bagong gamot na ginagamit para sa COVID-19. Nandyan po yung high flux cannula na ginagamit na alam natin mas nakakasalba ng buhay, yung Remdesivir, yung Avigan at yung iba pang mga bagong gamot po na ginagamit natin ngayon.
Opo, tanong pa rin po kay
pagbangon ng ekonomiya, well, nandyan nga po yung ating Bayanihan 2 kung saan magbibigay tayo ng ayuda na naman at iba pang mga tulong worth at least 160 billion pesos at gagamitin din po natin yung 4 trillion plus budget for 2021 bilang stimulus package din para tayo po ay mabilis na makabangon dito sa sagulot na dulot po sa COVID-19.
May tanong pa rin po para po kay Secretary Villar. Secretary Villar, When will be the final schedule daw po of the construction of the bridge linking Davao City and Garden City of Samal? Is there still a need to consider the work specification and variations on the projects? Do you consider a direct connection to the airport terminal as Samal Island is more on tourism hotspot? Aside from Samal Bridge daw po as major project in Mindanao, how about the project on Mindanao Railway System? Are you considering to finish this under the administration of President Rodrigo Duterte?
Salamat po. Sa Davao Samal Bridge, with regards to ang magiging ang magiging format po ng bridge ngayon is design and build. So ang design and build ipapabid out sa October, November at pag natapos po yung bidding, gagawa sila ng mga final design. So pwede magkaroon ng mga design adjustments pero more or less nakaset na po yung alignment ng Davao Samal Bridge and we expect that by next year we will start the actual construction of the bridge. At regards to the Mindanao Rail Network, a project po ng DOTR, ang alam ko po, better siguro mas mabuti tanungin po natin si Sec. Art Tugade kasi under sa DOTR yung Mindanao Railway.